Hello everyone, I am Dr. Ranjith, consultant neurologist, Medicover Hospitals, Madhapur. Today I am going to talk about migraine. Migraine is a common health condition which affects about 12 to 25% of population. A person is said to be having migraine if he has episodic unilateral headache at least since past 3 months, which is causing disturbance in his daily routine activities. But this is the typical definition of migraine, but there are many variations in how migraine can happen to a person. Some people will be reporting of holocranial headache, that is headache all over the head. Some patients might be having a visual aura, that means there may be some visual disturbances before the headache starts. Some patients might be having headache without aura, and this headache can be episodic in some patients, that means on and off, and in some people this headache might be chronic, that means they will be suffering from headache throughout the month. So there are different types of clinical manifestations in migraine. Many patients with migraine report of typical precipitating factors which they notice during the headache episodes. Some people will report of sensitivity to bright lights. Some people will report of sensitivity to loud sounds, and some patients will not be able to tolerate any kind of smells, and some patients will get this headache when they are traveling, and some patients may notice that this headache is getting precipitated when they are eating particular foods like chocolates or cheese. So these are the precipitating factors which some patients may notice and report to us. And in females, this headache or migraine episodes can get precipitated during the menstrual cycle. Other symptoms associated with migraine are patients with migraine along with the headache, they may report of a severe nausea. Some patients may have giddiness or vertiginous sensation, and few patients may have even neck pain. And in few rare cases, some patients may present with headache and ophthalmoplegia, that is difficulty in moving the eyes. And in few patients, rarely they may present with migraine and hemiparesis, which is called as hemiplegic migraine. So these are the rarities. Treatment of migraine is very individualized. So each patient's requirement may be different, and each patient's frequency of headaches and the severity of the headaches will be completely different. Based upon the severity of headache, frequency of headache, and taking into consideration of their other health conditions, we tailor the migraine treatment which is individualized to that particular patient. So migraine treatment has two types of therapies. One is abortive therapy, that means medication which are given to subside the pain, and other medication are prophylactic therapies. Prophylactic therapies are the medication which are given over few months to decrease the number of episodes of headache and also to decrease the intensity of headache. Medication which are used as abortive therapy are paracetamol, NSAIDs like naproxenic acid, and triptans. So these are the common medication which are usually used to abort that attack of severe headache. And the medication which are used as prophylactic therapy are propranolol, that means beta blockers, and calcium channel blockers like flunarizine, and anti-epileptics like valproic acid and topiramate. These are the usual medication which we give as prophylactic therapy. And there are many advances in treatment of migraine in recent period. There are many recent advances in treatment of migraine recently. There are now treatment options like CGRP inhibitors, which can be given once a month in prevention of migraine attacks. And even there is a treatment option called as Botox therapy, which can be given once in 3 months to decrease the intensity and also to decrease the number of the times a patient gets headache. Thank you.